Now let's talk about some electroacupuncture specific terms. So these are terms that we'll use frequently talking about the various devices we're using and the treatments that we're going to do. So intensity, frequency, mode, waveform, pulse width, and then millicurrent, microcurrent. Intensity. Again, this gets back to current, amperage, the strength of the sensation the patient feels during the treatment. So as you turn up the amperage, you turn up the stimulation, patient feels it more. Usually when we're talking about intensity, we're dividing it into kind of high and low or high, low, medium and low. But high and low I think is useful. Higher electrical resistance is going to require more intensity. So there's various ways that the resistance may go up and the patient may not feel it as much. You need to turn it up more. So a higher setting, say the needles are farther apart and the patient is obese. They may not feel it as much when you turn it up high. You may have to get it up fairly high to get any sensation at all. Whereas if someone is thin, the needles are closer together, they're going to feel it more readily. So you can't just say, oh, I always set it at this intensity for this treatment, because it's going to vary from patient to patient. We'll talk later about what the variables are and what to look out for. So some effects of high and low intensity. Low intensity, there's less felt sensation. Of course, high intensity, they're going to feel it more. Low intensity is going to activate the parasympathetic nervous system. So this is the part of the nervous system that kind of shuts things down, makes things calmer, lowers blood pressure. High intensity tends to activate the sympathetic nervous system, which causes more arousal. Now, here's an irony of this. Low intensity is going to be more effective for localized pain. So they've got a pain in their elbow. You do some low intensity electroacupuncture around the elbow, pain goes down. High intensity produces more generalized analgesia. So in those surgeries in China, believe it or not, they're using a fairly high intensity signal. Because what happens at a certain intensity level, the patient starts their consciousness starts to decline. And so their system sort of shuts down. And they become very relaxed, and they become very calm, and they actually will fall asleep quite easily. So even though, this seems ironic, it activates the sympathetic nervous system, it can also produce generalized analgesia. Now, we're not using it for that purpose in this country, and I don't recommend this. There are some situations, in fact, that I would caution against using high-intensity treatment, like with stroke patients, for instance. They may not be able to feel it as much, so you keep turning it up so they can get some feeling. But then if it stays up for a long time, they may actually get very groggy and sort of marginally awake, and then it might be difficult for them to do things after the treatment. They may take a while to arouse themselves. So I don't really recommend high-intensity treatment for people who have already had some reduction in nervous system function. So low intensity may reduce blood pressure. High intensity may raise blood pressure, at least initially. Encourages relaxation, low intensity, whereas high intensity may actually reduce consciousness. And then you might say that, you can look at it this way. Low intensity is probably more tonifying. It's less, the stimulation is not as strong. So it can be conceived of as being a milder treatment, more tonifying treatment. Whereas the high intensity is more reducing or dispersing. This is in, acupuncture oriental medicine terminology. Electroacupuncture, again, another term is frequency, and frequency is very important in our machines. They all have the ability to adjust frequency. Frequency are the pulses of electrical current, so it doesn't just come out, continuously. It comes out in pulses. And these are measured in hertz, which means I think it's named after some guy named Hertz, and it means pulses per second. So it's how many times per second do the electrons shoot through the current. And this is, again, usually divided into low frequency and high frequency, or low, medium, and high. Low is in the half a hertz to 10 hertz range. medium like 10 to 30, high 30 to 200 and up from there. Some people use even higher frequencies. Most machines on the market don't go over 200, or maybe some go up to 400 hertz. There are very few cases where you'd want to use really high frequencies. Some of the effects of a low frequency, this is again in the 0.5 to 10 hertz range. The patient will feel a slight tapping sensation. They'll feel a little, something's happening there, they can feel it. It stimulates mainly, it's because it's causing motor neurons to fire, and so they're feeling that little, usually feel it as a tapping or a little pulling sensation. Causes muscle contractions, and then what we know from research, basic research, is that this activates the central nervous system, and it causes a release of beta endorphins and enkephalin and orphanin. Very useful for pain control. So low frequency is often used in pain treatments, both chronic and acute. And I use this all the time. And it works better for chronic pain and wound healing. It does have a slower onset, but a longer duration, and it's cumulative. So as you're using this, it takes longer to get an effect, but once you get it, the effect builds over time, and from treatment to treatment. High frequency, here we're talking again in the range of 30 hertz and up. The patient's going to feel more of a buzzing or pulling sensation. Muscle tremors start at around 10 hertz, and then at 30 hertz you start to get tetanic contractions. So what happens is you're stimulating the area and the muscle contracts during that part of the treatment, and then it relaxes. So it causes a big contraction of the muscle. At 100 hertz and above, sensory neurons depolarize. And so what you get here is a loss of sensation. It starts to you really get a deep relaxation happening. So it activates the brainstem, the spinal cord, and neurotransmitter dynorphins. So again, it has other kinds of effects on the central nervous system that are widespread. This is better for acute pain and spasticity. So someone who tends to have muscle spasms, like someone with cerebral palsy, for instance, high frequency might be called for. It's of rapid onset and short duration. So the effects come on quickly, but they don't last as long, and they're not as cumulative as low frequency treatments. And we'll talk about how we can get the benefits of both. So the next term here we're going to look at is modulation or mode. This mode is a reference to the regular changes in frequency output. So you've got low frequency, medium frequency, high frequency. But there's different ways that you can deliver that. And most devices some devices just have one mode, or just do what we call continuous or constant. But there are three modes that are commonly found, and those are here: continuous, discontinuous, and mixed mode. Now, continuous or constant mode is just what it sounds like. You turn on a certain frequency, say it's at 2 hertz for 20 minutes, and that's what you get. You get 2 hertz for 20 minutes. Some devices only do continuous mode. Some of the simpler TENS units only do continuous mode. And that's all you get. And that's great for some things. For pain, it works great. Discontinuous or intermittent or burst is the same thing. You have one frequency, but what happens is it comes on. It's on for 6 seconds, say, and then it goes off for 6 seconds. So there's nothing happening. And then it comes back on. So you have 2 pulses per second for 6 seconds, and then it stops. And it goes back. And it stops. And so for the whole duration of the treatment, you could have discontinuous mode. We'll talk later about how these are used. And then mixed mode is kind of a mixture of fast and slow, or dense dispersed, they sometimes call it. So you can have a high frequency and a low frequency operating at the same time. So again, 6 seconds. And then it goes to a higher frequency. And then it slows back down, and it goes back to the high frequency. So it goes between the high and the low. And so you can have both, and you get the advantages of both. Some machines have other modes, and there's some that will take the low and high, and it'll ramp up. So it'll go from low, and it'll gradually increase to the high, and then it'll go back down. There are all kinds of ways of modulating the frequencies. And some machines will have a program mode where it'll go from constant to discontinuous to mixed, back to constant. So it'll kind of mix all of these modes up together. There's not a whole lot of research on these that I've found, but there is research on continuous, discontinuous, and mixed. We kind of know the effects of those, so we're going to focus on those three. First, we'll talk a bit about continuous mode, or constant. It's typically used at lower frequencies, so 2 to 10 hertz again. Typically used for pain relief, analgesia, and substance abuse. It's real useful for treating substance abuse. So this is it's like a very sedating treatment. The patient will become very relaxed. They get all those endorphins kicking in, blood pressure lowers, parasympathetic response happens, and they're just feeling no pain after a while. Can kind of put them to sleep. Now, the kind of disadvantage of this is that with constant mode or continuous mode, eventually the patient will build up some tolerance. And so a lot of times you turn it on, you've got the machine set so they feel a little something. You leave the room, you come back, and they say, I don't feel that as much as I did when you first started it. And so you may have to come back and turn it up a little bit. But it can be a way to really sedate patients who are agitated or in a lot of pain, and it can really knock the pain out. And again, continuous mode, low frequency, low intensity, you're going to find the patient gets very relaxed and will fall asleep, and that you'll have a cumulative effect over time. But you also will find you'll probably have to turn it up more, turn up the intensity more over time. So with discontinuous, you have, again, a single fixed frequency, but it comes on and off. And this is commonly used at higher frequencies, so 30 and up. Typically, I would use it at 100 hertz. And this causes a big muscle contraction and then a release, because it comes on and you get that tetanic response where the muscle just knots up and contracts, and then it releases. And then it comes on again and releases. And so this is used for certain things. It's a limited usefulness to this particular mode, but paralysis and muscle spasticity are one of the big things. So patients who are paralyzed, patients who have, it's a good workout for them. Those muscles that can't move, you can give them a workout. So it helps with muscle atrophy. You can also use it on cerebral palsy patients who have spasticity, or other patients who might have spastic muscles, because something about that big contraction and release causes the muscle to relax and spasticity to stop. You can also use this to treat edema in the extremities. So someone has edema in their leg, elevate the leg. Using discontinuous mode, you cause that big muscle contractions in the leg, and you can, it's essentially kind of pumping the fluid out. So it can be very useful, but a limited range of applications. And then my favorite, mixed mode, dense disperse, fast slow, however you want to term it. This mixes 2 frequency settings, usually one low and one high, and it has the advantage of both low and high frequencies. So there's less tolerance buildup because you're not just doing low frequency constant treatment, you're also mixing it with high frequency. And it's clinically probably the most commonly used and comfortable mode. And the reason for that is, low frequency will cause kind of a constant muscle contraction. And then high frequency causes the big muscle contraction and then a release. So what happens with constant is a muscle gets really tired. It gets worn out from that constant contraction and release. But with this, you have that big contraction and release, which also helps restore blood flow to the area. So you get this mixture of these two that has the advantages of both. And so patients who are being treated for muscle atrophy, actually mixed mode works much better because you get both the exercise of the muscle plus increased blood flow to the affected area. Less tolerance buildup, and the intensity can be limited, and this is the caution of this mode. The intensity that you turn it up is limited by the patient's tolerance of the higher of the two frequency settings. Because typically, if it's set at 102 hertz, 2 hertz and 100 hertz, at 2 hertz, it's going to be pretty comfortable. It's going to be just a little tapping. But that 100 hertz is going to feel like a really strong sensation, especially at first. And so when you're turning up the intensity, you want to make sure in mixed mode that you're only turning it up when it's on high. So you watch the machine to see, okay, now it's going at the 100 hertz, now I'm turning it up. And so when the patient says, oh, yeah, I feel that, that's when you stop. And then you try to modulate that a little bit and ask them, well, how does the low intensity feel? Or how does the low frequency, how does the high frequency? Are you feeling the slight tapping? Are you feeling the big contraction? And then when you find a comfortable spot for them, you always want to make sure the patient's comfortable with what you're doing. And with mixed frequency, you just have to have that little caution about how you're turning it up. Commonly, you're setting the low end at 2 to 4 hertz, and then the high end can be 15 up and up. And I've gone with 15 in the past. Now I tend to go more with 100. I like 2 on the low end and 100 on the high end. That seems to work really well. This improves blood circulation with less muscle fatigue. It's probably also better for long-term treatment because there's less tolerance buildup. It reduces hypertension. Again, it lowers blood pressure. And you can treat many types of pain and many other conditions with mixed mode. Mixed mode is kind of my default unless I'm trying to do something much more specific. And then I would go to constant or discontinuous. So here's another term. We're going to come back to all of these as we go through and get into the treatment part later on. Waveform. Waveform is a visual representation of the variation in electrical current over time. So, and here's some samples of, sine wave, square wave, triangle wave, sawtooth. It shows how much current is being sent and the duration of the signal. Waveform in most devices is fixed. There's a waveform that's built into the device. You can't modify it. There's a few devices that may have a couple of different waveforms you can choose from. But most of them are going to have a fixed waveform. Most use some variation of the square wave or the symmetrical, and it could be either a square symmetrical or asymmetrical. The picture on top here is a symmetrical square wave. On bottom is an asymmetrical square wave. So as you can see, this is a measurement of, how much is coming through, how much current, how much voltage is coming through, and then how does it drop off and go the other direction. So you've got, remember you're going both directions, positive and negative, with biphasic machines. And through research, they found these waveforms are the most comfortable and effective for treatment, both with TINS and with electroacupuncture. With Millicurrent and TINS, we tend to see the asymmetrical square wave. With Millicurrent, as you can see, the positive and negative are about the same, but the shape of the wave is different. They have a negative spike. And then with the TINS, same thing, only the negative spike's much bigger. Now, why is that? And these are, by the way, the parameters used by the Pantheon research devices when they're using either electro or TINS. They have a little switch to go back and forth. So the big negative spike is to overcome the electrical resistance of the skin. It's because in TINS, you're not putting a needle in. Remember, you're just using the surface of the skin. You've got to get through that electrical resistance that's on the surface. And so they use a negative spike to get through it. Some machines don't do that. They use the same waveform for TINS and electroacupuncture. And with those machines, they may have a switch that turns up the intensity. So they're turning up to a higher intensity level, putting more current through to break through the electrical resistance in TINS. I think it's a little safer what Pantheon does, using the actual waveform to change that. Because the other way, if you're turning up the intensity with a switch, if you're doing electroacupuncture and you accidentally leave that switch on TINS, you could create a lot of sensation. I suppose you could with this waveform as well, but I think it's a little safer to have the waveform than it is for TINS, rather than having just a higher intensity. And then with microcurrent, they use a different waveform. To attach to needles, they use a square wave with a little gap in between pulses. So it's a biphasic square waveform, and it's used for needle stimulation only. This will not work with TINS or probes or anything else. And then pulse duration. This is the time a single electrical pulse, usually measured in microseconds. Most devices, the pulse duration is going to be set to 250 microseconds. So this is a very short duration of that pulse that's going out. And remember, these are going out at, these pulses are going out at so many pulses per second, but the duration of each pulse is in the microseconds. So even if you're putting out 100 pulses per second, because they're in microseconds, the pulses are still very tiny, and so there's a little gap between the pulses. Most devices, this is not adjustable. Some devices, there may be an adjustment to the pulse duration. So milliamp and microamp, these are the two terms that are really important to understand the differences. People get these mixed up all the time. So milliampere, and the symbol here is a small m with a capital A, milliamp. This is 1,000th of an amp. So sometimes we call it milliamp, sometimes we call it millicurrent, same thing. Most electroacupuncture devices are going to deliver between 0 and 25 milliamps. That's kind of their range. That's about as much as you can get out of them, is about 25 milliamps. Microamp is 1/1,000,000th of an ampere, so it's much smaller than a milliamp. So remember, micro is smaller than milli. And the symbol here is the Greek mu for micro and the capital A. This is 1/1,000,000th of an amp. It's tiny, tiny. Microamp, microcurrent, we use both terms interchangeably. Most electroacupuncture devices are going to deliver between 0 and 1,000 microamps when you're in the microamp mode. The Pantheon devices, I think it's 0 to 600 microamps. Remember, when you hit 1 microamp, or 1,000 microamps, that's 1 milliamp. So it takes 1,000 microamps to make 1 milliamp. So it's a tiny amount of current, but once you get into the milliamp range, you start to lose the microcurrent effect. We'll talk more about that when we get later to specifically talking about microamp. Oh, well, here it is, microcurrent. Studies show that at 50 to 1,000 microamps, that small range, you get an increase in cellular ATP, 3 to 5 times. You get a similar increase in protein synthesis. So you could say, and this is used actually in medicine, microamps help heal injured tissue because they increase cellular energy. We would probably say in acupuncture terms, that's more tonifying. Microamps, again, it's smaller, it's more tonifying. So it's used for healing. And in Western medicine, it's used for bone healing, it's used for wound healing, it's used for a variety of things like that, where tissue is not healing properly, let's put some microamp in there. What are they doing then? I question this. Well, remember Becker talked about the current of injury. The current of injury is whenever there's an injury to the body, the first thing that happens before any other changes happen is the electricity, the electrical activity around that area changes. It increases dramatically. And then the body sends white blood cells and all kinds of other materials to that area to try to heal that wound, to try to take away any foreign materials and neutralize any infections. But the first thing that happens is the current. The current changes. And Becker got into this by studying, lower life forms of salamanders and amphibians that are able to actually generate such a strong current of injury that they can grow a new arm if you cut off their arm or leg or tail. And he discovered we don't have that especially after puberty. Our ability to heal goes down, but we do have it at some level. And so the current of injury is very important to understand in the healing process. I think both acupuncture and especially microcurrent electroacupuncture helps to replicate the current of injury and because the body sometimes doesn't heal completely and kind of stops. And then we're kind of going in with either just a needle, doing some micro trauma, or we're using microcurrent actually to remind the body that it still needs to heal this area. And here I'm citing the research on the ATP effects of microcurrent. What was found by Cheng in his paper was that the effects, this effect of increasing cellular ATP and protein synthesis drops off as you increase, and it starts to drop off around 1,000 microamps, and then around 5,000 microamps or 5 milliamps, it disappears and reverses itself, and it starts to actually go the other way. So the implication of this is, when you're in the milliamp range, you are actually decreasing the cellular energy because you're making the cells work. They're contracting, they're doing things. But in the microamp range, they're not doing that, and so the cellular activity increases. Other important terms to understand, we've talked about TENS. This stands for transcutaneous electrical nerve stimulation. This is done through electrodes or pads on the surface of the skin. And then we have something called percutaneous electrical nerve stimulation, and this is done through electrodes attached to needles. This is electroacupuncture. And so they penetrate the skin, kind of overcoming that electrical resistance that's on the surface. And then we have microcurrent electrical nerve stimulation, or MINS. It's another term for microcurrent electroacupuncture. So transcutaneous, TENS, percutaneous, PINS, and microcurrent, MINS. Microcurrent and percutaneous are kind of the same thing. It's both with needles. It's just the difference would be millicurrent and microcurrent. TENS requires more current to overcome the higher electrical resistance and probably will use a different waveform. Many electroacupuncture devices will have a switch, and so look out for that switch. If it has a switch, you want to make sure you're in the right position for what you're trying to do. If that's electroacupuncture, put it in the acupuncture mode. Switch may be labeled TENS acupuncture, or sometimes it'll just say high-low, or H and L. You want to be L. You want to be low. You don't want to be in the higher range. And then you want to make sure these switches are in the right position. Let's talk about the devices that are out on the EA marketplace, the electroacupuncture marketplace. And if you go online and you start looking, you're going to find all kinds of things. Cheap, expensive, made in places you've never heard of, made in the good old USA, made in Europe, Japan, China, everywhere. And you're going to see a lot of devices. And so let's talk a little bit about how you navigate that and what's the range of things that are out there. So one of the first things you're going to see that on the simpler and cheaper end are these types of devices. These are handheld stimulators. The one here, the Pointer Excel, is basically a handheld TENS unit. It can be used for point detection. It can be used for treatment of points. It's all transcutaneous. There are ways you can do this where you can hold the probe tip up against an acupuncture needle and treat that needle. Very, kind of choose needles and treat them around the body. Some people do this. Mainly this is used by physical therapists and massage therapists, some acupuncturists, to treat muscle problems, musculoskeletal issues. It can be a very useful little tool. It's not that expensive. I think they're a little over $100 for these. On the other end, you've got these piezo pins, which have a little quartz crystal inside the shaft, and then it's almost like a pin. You click it on the end, and it compresses the quartz crystal and sends out a electrical charge. These can be also very handy. You can just put them in your pocket, carry them around, and you can, again, treat muscles, treat points very quickly. But that's not what we're really here to talk about. Then we get into some of the consumer devices. You may see patients that will have these, or they may be prescribed to a patient by a physical therapist or a doctor or a chiropractor. These are TINS units, basically, that are made for patients to take home, put the pads on the affected area, and treat themselves. A lot of athletes will have TINS units for themselves. Then we get into the Ryodoraku and Electroaccupuncture according to Vol devices. These are this is based on the theory that you can measure the point, measure the electrical resistance, and then come up with a treatment based on that measurement. There's not a lot of science behind this, but there's a lot of people out there that use these, and some of the devices are fairly technically sophisticated, as you see here. Point treatment and detection and treatment devices following the theories of either Nakatani or Vol. And then you see some of these higher end devices. These are, they tend to do about a little bit of everything. Milliamp, microamp, point detection, Russian stim, kind of you name it, they can do it. These are devices that cost into thousands of dollars, $7,000, $10,000, $12,000 devices. Typically you see these, the Electroaccuscope, the Accutron Mentor. Sometimes you see these in acupuncture offices, sometimes in chiropractic offices. Estheticians use these. They're not really designed for electroacupuncture. They're designed to be used with probes or pads. You can see with the Accutron Mentor, there's some little alligator clips that can be attached to the wires in the machine. And so you can actually use them on needles. And this is really a remarkable device. It does a number of things. It was designed by an acupuncturist, Darren Starwin. And I've seen him take a needle and actually put a TINS pad over a needle and then treat the point through the pad and through the needle. I don't really like that method, but you can do a lot of things with these devices, and they're very expensive, and they do a lot. If you're going to use one of these, I highly recommend that you seek out all the training you can get in how to use them, because they're so capable and they're so expensive to buy. You really need to understand the full scope of what you can do and employ the device to its maximum. But they're not, again, what we're really talking about in this class. We're talking about electroacupuncture devices, the simpler devices that do just a few things. And one of the choices you're going to see on the marketplace are the Chinese-made Milliamp devices. And there are a number of these out there. Here's 3 examples. The AWQ devices and the KWD device. They're Chinese-made devices. They're actually... they've been around a long time, but you have a lot of problems. They tend to be less reliable. They tend to have more safety issues. They tend to fail more. The controls can be difficult to understand, and the features they have sometimes difficult to interpret. And the other thing you have with Chinese devices, even if you get a good one from a good manufacturer, somebody may open up a factory down the road and make a knockoff of that device and then market that as being the same thing. And you may not know what you're getting. They tend to be a lot cheaper than the Japanese and American-made devices, but I I do not recommend them because of you don't know about the quality. And here's some more. These are from Taiwan and Korea. And the Han device from Korea may actually be quite a good device. I don't like the controls on it, and so I haven't recommended it for that reason. I don't like digital controls that you just push a button to increase intensity. I much prefer to have a little knob so I can feel my way up when I'm turning up intensity. The Helio device here on the upper right was made by the Helio company, and they've taken it off the market, unfortunately. I think they had some problems with it. So I don't know about its reliability either. I liked the features it had. So again, unknown quality, not a lot of testing on these, so we really don't know what they're doing, and I don't really recommend them. The Japanese devices made by the Ito company are quite reliable. They've been around a long time, Ito has. They are kind of famous for being high quality devices. You can see 3 of them here. The Ito ES130 is the little Ito. It was formerly the IC1107, which, if you remember, was the first device approved by the FDA, first electroacupuncture device approved by the FDA. And basically it's a TENS unit. It does one thing. It does constant, continuous stimulation. You have some frequency control, but not much more than that. And it does that well, but it has some limitations as well I'll talk about later. The old Big Ito up here in the upper right is no longer available. It was a 4-channel device, Millicurrent, and then there's the new Big Ito, the ES160, which does 6 channels and Ryota Raku. And as you know, I don't think a lot of Ryota Raku. I suppose for those who like it, it's great, but I don't see the usefulness of having that. This is a quite expensive device. It's about $700, and it has features that it doesn't really explain how you would apply them to patients. The documentation that comes with it basically explains how to use the unit, but doesn't really tell you how to use the different parameters it has set up. So it's a reliable device. I've used this device, but I don't, again, recommend it at this point. Then we have Pantheon Research. Pantheon is an American company. It's the only American manufacturer of the basic electroacupuncture device that we're going to talk about here in this class. And the research on Pantheon has been good. They had the best performance in the tests that NIMSAO did. They were the one unit that performed according to the parameters. You remember there's one that had less than 0.1% variation in its frequency. That was Pantheon. So this is a very reliable device. It does what it says it will do. They have 4 different electroacupuncture devices that they make. In the Pro series, it's the 4C Pro, 6C, 8C, and 12C. And they each add features, and they go up a little bit in cost with each level that you go up. I think the 4C Pro is like around $350, and then as you go up, it kind of bumps up in $50 or $100 increments. The 12C Pro, you see here, the larger unit, I think is around $600 for that. But a very capable machine, more than most people would need, I think, unless you're working with neurology patients. But most people could do just fine with one of the 6 or 8C Pro units. Only U.S. manufacturer of a basic EA unit. It does both millicurrent and microcurrent. The 3 upper, the 6, 8, and 12C Pro do both, milli and micro. And the 4, 6, and 8C Pro all do TENS as well as electroacupuncture. The 12C Pro is designed exclusively for electroacupuncture. They call it a PINS electrostimulator. Why do I like Pantheon? Well, I'm not getting paid by Pantheon. I have no financial relationship with them whatsoever. I have only talked to them on the phone. I haven't even met them in person. But Pantheon, they have a basic design. It's easy to learn, easy to understand, yet it's sophisticated enough for most people's applications. I'd say 99%, 95, 99% of acupuncturists are going to find the Pantheon devices are just great for anything that they're going to want to do. They're made in the USA. Now, this is an unusual thing these days. The company's actually based in California. They've been extremely reliable. They have a 2-year warranty. Most units only have a 1-year warranty. They have 2-year warranty. And the thing about their 2-year warranty is because they're based in the United States, if you have any problems, you can call them up and someone will talk to you. And they will be very responsive to your problem and they will fix it. Either replace your unit or fix it. And I've been using these for years, and I've had students purchase these. And in the entire time, about 10 years that I've used Pantheon units, I've only known of one student who received a unit that didn't work out of the box, and it was immediately replaced with one that did work. So, I mean, everybody's going to have an occasional something slip through that doesn't work properly, but their units have always been great. They have the most accurate performance, as I mentioned earlier, in the Niemsau tests. They have excellent safety mechanisms, and they have a built-in self-diagnostic test to find out if there's something wrong with the unit.